Last time we covered the heavy hitters. Well, buckle up, because the male body isn't done portraying itself. From infections that feel like you're peeing fire to this painful condition that chokes your intestines, today we're counting down 5 more excruciating things a man can experience. All right, let's dive right in. Number 5, urethral stricture. Imagine trying to pee through a coffee stirrer straw. Seems kind of impossible, right? Well, that, my friends, is basically what happens with a urethral stricture, or scar tissue that narrows the tube carrying urine out of the body. How does one get a urethral stricture, you ask? Trauma is a big culprit. Groin injuries, accidental falls on a bike bar, or previous surgeries or catheters. Infections can scar the lining. Chronic inflammation slowly tightens the pipe. For some men, there's no dramatic moment, just a slow decline until one day the bladder's screaming and nothing's moving. Symptoms start subtly, a weak stream, straining, or spraying. Then come the marathon bathroom sessions, post-void dribbling, and deep pelvic ache from a bladder that just won't empty. To diagnose it, we'll run urine flow tests, use an ultrasound to see how much urine the bladder is holding, and sometimes order a retrograde urethrogram for imaging. The real proof comes with a cystoscopy, a thin camera that goes inside the urethra so you can see exactly where the narrowing is. I guess the only silver lining in the painful story is how we now treat it. You see, treatment used to rely heavily on repeated dilation, basically stretching the scar with progressively larger instruments. The problem with that, though, scar tissue loves a comeback tour, meaning it tends to reform and sometimes even tighter than before. Thankfully, modern treatment has come a long way. Today, doctors focus on precision instead of repetition. For short strictures, we use a procedure called an internal urethrotomy, making a small incision from inside the urethra to open the narrowed area. For longer or more stubborn strictures, urethroplasty is the gold standard. That's where we actually rebuild or replace the damaged section using tissue from somewhere like inside of the cheek. Pain-wise, strictures deliver the old 1-2 punch, that burning stinging every time you try to urinate, plus the deep cramping pressure of a bladder that just won't empty. And when you hit full urinary retention, meaning you can't pee at all, the pain skyrockets. That's when we step in for pressure relief. Pain score, easy in 8 or 9 on the I can't pee and everything hurts scale. Number 4, Fournier's gangrene. This is the kind of case that makes the hair stand on the back of every ER doctor's neck. Fournier's gangrene, a rapidly spreading, flesh-destroying infection of the perineum. You know, that small patch of skin and tissue between the genitals and the rectum? Not exactly an area you want under attack. When it strikes, the smell alone can stop you in your tracks. A sharp, unmistakable odor that tells you something deep under the skin is dying. Early symptoms often fool people. At first, it just looks like a mild skin infection, but the pain, it feels too much for how it looks. Patients often describe it as deep burning or pressure light spreading beneath the skin. Within hours, that pain intensifies, the skin begins to darken, and crepitus, a crackling sensation caused by gas-forming bacteria under the skin. The infection starts releasing toxins that kill tissue from the inside out, and the pain goes from, wow, this hurts, to I've never felt anything like this in my life. So who's at risk for Fournier's gangrene? Men with diabetes, immune suppression, those who have had recent surgery, or neglected skin abscesses. In the ER, diagnosis is often clinical. We trust the pain. Imaging like CT scans can confirm gas in the tissue. But this is one of those cases where we don't wait around for a perfect picture. The infection can advance centimeters per hour. So once we suspect it, it's usually straight to the operating room. Treatment is old-fashioned in the best possible way. You cut out the dead tissue, and you do it fast. Historically, this condition was almost always fatal. Before antibiotics and modern critical care, mortality rates hovered around 80%. Today, thanks to faster recognitions and surgical intervention, survival rates have improved dramatically, though recovery can still take weeks and often involves reconstructive procedures. Pain scale, 10 out of 10 and then some. Patients describe it as burning from the inside out. It's a kind of pain that doesn't make you cry, it makes you beg for mercy. Number 3, prostatitis. Let me paint a painful picture. Imagine sitting on something sharp and foreign, like a golf ball sized shard of glass. Not exactly the image you wanted today. And that's how many men describe the agony of acute prostatitis, a sudden inflammation of the prostate gland that sits just below the bladder. It's one of those conditions that seems to come out of nowhere and makes every trip to the bathroom feel like punishment. You see, the prostate's job is to help make seminal fluid, the liquid that carries and nourishes sperm during ejaculation. But when bacteria sneak in, often from a urinary tract infection or even after certain medical procedures, the prostate can swell up fast, and that swelling presses on the urethra and bladder, making urination feel like forcing fire through a narrow, swollen tube. When men show up to the hospital doubled over with "I can't sit, I can't stand" energy, we usually start by ruling out kidney stones or appendicitis. The rectal exam, yeah, the dreaded one nobody loves, but this often gives us the first clue if we are dealing with a swollen, tender, boggy prostate. From there, we run urine cultures, blood work, and sometimes an ultrasound to check for abscesses. Treatment depends on severity, but usually includes strong antibiotics, anti-inflammatories, and fluids. Rest in the recovery process is crucial too. No long bike rides, no caffeine or alcohol, and definitely no trying to tough it out. Warm baths and hydration can often help, but this is not, I repeat, not something cranberry juice can just fix. And here's a key update. Older medical textbooks used to suggest prostate massage to drain infection. Don't do that. We now know it can actually push bacteria into the bloodstream and make things dramatically worse. Pain-wise, prostatitis sits high on the scale, often an 8 or 9, that just grinds on day and night. The ache is constant and sitting can feel impossible. The good news, when caught early and treated properly, most men recover fully within a few weeks. Number 2, inguinal hernia strangulation. Most hernias start off as a mild inconvenience. It's a soft bulge in the groin that pops up when you cough, strain, or lift something heavy. It's annoying, sure, but not usually a full medical crisis. That is, until it traps a loop of intestines and cuts off its blood supply. That's when the situation goes from to get in the car right now and go to the hospital. The pain changes instantly from a dull pressure or tugging feeling to a sharp, constant, gut-wrenching pain you can't escape. The bulge hardens, the skin turns red or purple, and even the lightest touch can make you see stars. At the hospital, we can tell a lot by look and feel, but imaging like an ultrasound or a CT scan can confirm if blood flow has stopped. Once that happens, it's straight to the operating room. Surgeons can work fast to release the trapped bowel, assess if it's still alive, and repair the defect in the abdominal wall. If the tissue is healthy, medical mesh can reinforce the area. If not, we may need to remove the dead segment and reconnect the intestine. Pain-wise, strangulated hernias are near the top of the scale, a 10 out of 10. Patients are pale, drenched in sweat, can't get comfortable. This isn't the kind of pain you sleep off. It's a kind of pain of nightmares. And what's crazy is the difference between a quick laparoscopic repair and major abdominal surgery is often a few hours. Now for a little good news. If you are one of the unlucky souls to get a strangulated hernia, modern anesthesia and minimal invasive techniques have made recovery worlds better than it used to be. But no surgical wizardry beats early recognition. If your hernia suddenly doesn't go back in and the pain turns sharp, the clock's ticking. Get medical help immediately. If listening to all this pelvic mayhem has your nervous system dialed up to an 11, you may want to check out Chillax by my company Life Happens. Chillax is a de-stress supplement designed for those high tension days. You can find it at lifehappens.com or on Amazon. Number 1 most painful thing a guy can experience, a testicular rupture. You know that slow motion replay where a sports player gets hit in the groin and every guy watching in the world instinctively winces? Yeah, there's a biological reason for that collective pain. A testicular rupture isn't just a bad hit, it's a full-blown tear in the tunica albuginea, the tough outer shell of the testicle. Once that layer splits, blood and tissue spill into the scrotum, swelling skyrockets, and the pain detonates like a firework you wish you can unlight. How does this painful thing happen? The usual suspects: a baseball to the groin, falling on a bike wrong, a stray knee during a tackle. Most men describe a sickening pop and an instant wave of nausea and deep throbbing pain that radiates into the lower abdomen and back. And walking becomes an awkward, painful shuffle because at that point, gravity is not your friend. When this shows up in the ER, we move fast. First, we'll do a scrotal ultrasound with Doppler to check for tears and blood flow, but honestly, sometimes the exam alone tells the story. Then urology gets paged early because time matters here. As the old saying goes, time is testicle. You don't want to lose it. Back in the day, the thinking was ice, rest, and hope for the best. Not anymore. The modern standard is early surgical repair. We open the scrotum, evacuate the clot, repair the torn capsule, and save as much tissue as possible. If we get it within the first 24 hours, the odds of saving the testicle are high. Wait too long and pressure and tissue death take over fast. Pain score, it's a 10 out of 10, no question. The kind that breaks through even the strongest poker faces. I'm curious, have any of you had to deal with any of these excruciating experiences? Drop your pain scale and war stories below. If you cringed even once, go ahead and hit that like button and binge watch this entire playlist right here with more painful ER issues. And of course, make sure you subscribe and turn on your bell notifications so you don't miss a single video. Thanks so much for watching and stay healthy, my friends.